Thank you. My name is Robert Stegwee. I'm also part of the xShare project. And unfortunately, Nathan is not here to talk about the industry label, so I'll take over that part and also talk a little bit about the hub and the open calls that are out there. So if we're looking at what's happening, you've just been informed about the yellow button and the specifications around it. That's all great and good in terms of what a user can see, and especially a patient can see. But now let's look at the other side. What do I see if I actually buy an EHR system? The EHDS is very clear that it's a market regulation in part, so EHR systems cannot be put on the market without conforming to the electronic health record exchange format, or, well, I'll spare you the details in terms of the legal background. But and we actually said, from an xShare perspective, we need to investigate whether it's possible to have a label. To have a label that actually tells hospitals or other people that are looking at a system, not just accessing a system through a portal, but really looking at a system, whether this system is already prepared to deal with the electronic health record exchange format and to deal with what's happening. And as a part, also provide the yellow button. So that's what we're looking at. So really, as mentioned before, the project envisions everyone to be able to use a yellow button to actually access, share, link their data with any healthcare provider with a click of a button. And the label needs to be a safeguard that, yes, this application actually can provide that functionality according to the specifications, and it has been tested. Those are the two things that we've identified, and you may have seen that in Fabio's presentation earlier. Then, of course, the vision for that label has been developed over the past couple of months. And yes, there is a need to label things, but it needs to be kind of aligned with other labeling. I mean, we don't want to have a whole series of labels on an application or on a product where you cannot see the forest for the trees. So that's where we really are saying, well, it needs to be integrated seamlessly into other labels. And of course, the CE label is one of them, if you need to have a CE label on an application. If there's more labels like the Health and Wellness app label that SEN provides, if you want to have that on there, it needs to be integrated. And of course, there are differences in this, but that's what we need to be able to do. So it also needs to go, if we look at the second block, it also needs to provide for self-certification. At least that's the term that's being used in the HDS. My colleagues at the National Standards Institute kind of say, well, there's a misnomer there. There is no such thing as self-certification. It's either certification or self-declaration. But again, that's a different story. But so it needs to be possible through the xShare label to also incorporate this self-checking and self-declaration that, yes, I have gone through the steps and I can prove it. Here's the proof, and so I do declare that I'm conformant with these specifications. And in the EHDS, there's also already people and parties that are assigned to provide that testing environment. So we need to relate to that testing environment or have good reasons or good agreements with those national testing agencies that they will accept our tests as proof for their tests. How that's going to work, we don't know yet, but that's what's really important there. In all, this will be a cost to the providers of systems. And that is not something that the xShare project will cover endlessly. Of course, we will invest in a lot of these activities in developing and supporting people to do this, but in the end, there will be a cost attached to regulatory compliance, which is not new to vendors and to industry. But we need to make sure that it's containable, it's easy to manage, so that you don't have to put too much money and too many surprises into the regulatory process, because that's the last thing you want. So that's the vision for the xShare label. We will have an xShare label that will allow for a self-certification that is good, well integrated with all other types of labeling and certification that need to go into these products, so that it's a one-time only process, and that you don't have to redo the steps elsewhere. How that's going to happen, we don't know yet, but that's what we're working on. Any questions on the industry label? I haven't done it as nearly much as justice as Nathan would have done, because he's much younger and much more enthusiastic than I am. So I'm very happy to have him on the team and to actually lead this effort, because this really needs his enthusiasm and energy. Andreas.
First remark, the box you have on the right side up there, being an industry representative for the others here in the room, is of course something which makes industry very nervous. Of course, this is part of the regulation, that there can be more complex certification than via the national e-health authorities, but 27 of them. And getting a product in the market is probably requires then 27 of these labels. I don't know, maybe 28, because there's a European one, and then for each member state a special one. That is not really something which makes the industry very, very happy, of course. But there's nothing xShare can do. This is part of the regulation initially anyway. The other point is, you rightfully say, it should be as lightweight as possible. And especially regarding the self-certification, indeed a misnomer to a certain degree, because our expectation was it would really be a self-declaration, and we wouldn't have to go somewhere else to make that statement, like essentially like it's done with IHE integration statement or something like that, where the vendor just makes a declaration, yes, we support these profiles, and then it's up to the vendor to determine what we have to do to come to that conclusion. Unfortunately, it seems things go in a different direction.
Yep.
And indeed, there will be a testing infrastructure operated by member states, which has to be used by vendors, which makes it more potentially like a certification instead of a self-declaration.
Yeah, that's true, and of course there's now discussions in 27 member states how to do this, how to set up such a service based on a software platform that is being provided by the European Commission as kind of the blueprint or the box that you can use to actually set up this service. So a lot will happen there, and we don't know everything yet. But this is at least our vision for the xShare label, and hopefully we will be able to address some of these challenges as part of the xShare project and as part of setting up this label, so that we get clarity together with the member states on how this process is going forward, and we rely on our industry partners, both MedTech Europe and Digital Europe, as well as xShare, to inform us of what's going on and how we can relate to what's happening in the European Commission and across the member states, because you don't want to go somewhere 27, 28, 29 times. So, yes.
I'm confused if xShare label is like a generic interoperability label or something more specific. And for example, I would expect that it would be nice for you to force, let's say, an interoperability label to let's say that if an EMR doesn't have like file resources and stuff to connect with to share data, it shouldn't be published like from 2027 or something. Is something similar xShare label would look like this, or this is what I'm saying is something different?
Even there, I'm not quite sure what the decision will be. Of course, the fire labeling or the fire conformance should be part of the industry label, because that's what's behind the yellow button, and all this starts and complements the yellow button. So that will definitely be there, but there's other things that are being studied as well. As part of the Expand the Age project, Sen has led the work in embedding the interoperability requirements into the requirements for health and wellness apps. And that's also being used in other countries to inform teleconsultation and telemedicine setups. And labeling those services as well. So we still need to figure out, and we're doing, of course, a pilot, I think in Spain, in Catalonia with Tixalut, to actually test which parts of the frameworks that we know about are actually applicable to be used as part of the xShare industry label. So those choices of what it is going to be, how big it's going to be, we still need to make those choices. But if we want to test things now, just like Greece is already implementing the format right now, we are ahead of the specifications, and we take a guess, of course, a well-informed guess, that the specifications will be fairly close to what we're testing against already. So hopefully we won't get too many surprises once the European Commission actually publishes its implementing decision on what the format looks like. It would be bad if the people in this room would be surprised by what the Commission actually publishes by then. So I don't think that's going to happen. Charles.
Yeah, good luck.
Thank you. Sounds like an encouragement.
No, it's so two advice on how to increase the likelihood from 0.5% of this happening to 5%. Don't mix your level with other levels. Stay away from all of the security and safety levels, the CE marking and all of those things. Stay away from those, because if you try to associate with those, they will kill you along the way. They are complex, they have their political strings, they have certified bodies, a whole mechanics that has 30 years or 40 years of history.
I know.
Stay away from those. You cannot emerge if you try to be with them. So be independent, be the little Lilliput, appear on the market, be used on the market. Vendors don't care. They already have 20 labels, 21st, who cares? There is one more, one less. But keep it outside of those other labels that have all their strings attached. Otherwise, you're making your life a nightmare to decide on how to align with those. That's not useful time spent. It's time that would be, in my opinion, wasted. The second advice is there are actually two parts to the level. There is the visible part, which the level should address, which is what's happening between my app and a server, or a server and one or more apps that are connecting. So this, the real, I would say, yellow button interface. Stay away from the behind-the-scene infrastructure, because the behind-the-scene infrastructure will have all bunch of national variations. Will be deployed sometime, as we heard in Greece, as part of a national portal. In some cases, it's going to be deployed as part of hospital portals. And anything in between in all shape and forms. And if the xShare label is trying to say anything about those things, you now become hostage to 10,000 variant of things that are going to be a mess. So don't be hostage to the mess. Focus on the value add and the visible part that you bring. I believe with those two conditions, you are increasing the chances of success by a very, very large factor.
Thank you.
But, John, I think that there's a bit of a challenge. My understanding is the xShare label is not only about the yellow button, right? It's about the format.
Yeah.
About
Right, but the format to be transferred. It's about the interface.
Just we are required to certify that interoperability component in every of our apps, our products, which is unfortunately also most of that is actually on the infrastructure level. What you are saying, which has this impact from the member states.
Right, but they should stay away from that.
Yeah, but they can't.
They have to.
Let's continue that discussion over drinks. I would be very, very interested to hear your insights.
The vendors agree that this is a choice made with the label. The label is covering this part of the interoperability problem.
Yeah.
I think that's going to create a meaningful context and relationship. Stay away from the big EHDS compliance because that one will never exist. So don't become dependent on it. It's so complex that one will never land anywhere. And if you want to make your xShare label land, don't count on the EHDS, EHR compliance to be a help. They'll sink you. They are a huge anchor that is so heavier than you are, then the little xShare label will sink with the rest of the, and I don't think it should sink.
I didn't want to tie this to XDS or something like that. Again, the challenge is we have to implement this interoperability component in things that are called EHR system or EHR system. And we have to certify that this is working. And my understanding was we could show this, that we do this then with the xShare label, right?
Yeah.
So, which really transcends into even what is going on inside a hospital, because that's where these interoperability components are and then are running.
Yeah, but in all honesty, I have to say that we wrote this down before the agreement which introduced the interoperability components and the digital testing environment. So we still have to select which way to go. And I really value the discussion here to inform that discussion. Unfortunately, again, Nathan is not here to respond and take it in, but we'll be sure to communicate it with him. So I was also asked for the next part to say a little bit about how to join xShare or work with xShare, and that's where we really want to stress that we are about collaboration. We're not doing this just as a project. We're not doing this just because we're getting paid for it, or we can get some of our costs reimbursed actually, because all of us are doing much more than we signed up to do. But we do want you to actually implement the xShare yellow button, whether you're part of xShare and a partner of the project or not. So we will publish the guidance through the EHRxF website and also through the xBundle registry. And xBundle being the set of things that you need to actually implement a yellow button, including the architecture, including the implementation guide, but also other materials and some of the software components that you can reuse. So that toolkit will also be accessible as part of the xBundles, and we also are developing services to help you with that. And of course, we're testing out those services with our adoption sites. So we are working with the Greek ministry. We're working with all the adoption sites that Fabio mentioned earlier to make sure that we actually have the services in place to help them implement the yellow button. And we will also publish an open call. That's an open call for anyone who also wants to implement the yellow button for a specific use case. It could be, we already saw 5 different categories of use cases, and there might be more that you can think of. So anyone who has a plan to actually implement the yellow button can apply and can receive some funding and, but more importantly, support from the xShare community to actually make sure that you're part of the game and part of the format and part of adopting the format for better care. So how do we partner? We will partner through the hub. The hub will be your partner, and the hub is what we call the European EHRxF Standards and Policy Hub. I'm still not sure whether we want to call it that, but we just call it the hub. So it's really about beyond the xShare project, because it doesn't stop with the project, and we knew that, and we know from experience that if you say in your recommendations at the end of the project that yes, this needs to be taken on by someone else, it doesn't happen. It just simply doesn't happen. I've seen it with the Unicom project around medication, where we said we need to continue the community of expertise and the collaboration with the SDOs. Nothing happens. So you have to make it happen during the project. So that's why we're setting up the hub right now. And the xShare project will be kind of the incubator for that baby hub that will be created. And hopefully the hub will be mature enough by the end of the project to stand on its own. That's only 1.5 years of growing up. For babies on the human side, that's far too short. But hopefully we can do better than a human baby. Yeah, baby on steroids. And hopefully we will be able to get some steroids because some of this work that the hub does sounds a lot like the support center that the European Commission is looking for. So maybe the steroids will come from that side, but we'll see. So I want to stress that, yes, we are already somewhat in operation. We do have the website, we do have the X-Bundle registry. We are working with the adoption sites through Work Package 3, and we are testing our operations and developing our operations as we go. Hopefully, we will be more or less operational by mid-2025 at the time the open call starts, so we can be there to support you and to provide the services. Of course, it will be kind of the incubator environment, so we value your feedback on our performance, and of course it's also really a neutral place for co-creation. So it's not just we're not just a service shop. We're a place where we can work together and continue to work together in extending the format, in implementing the format, and in actually having an impact on patient care in general. So that's what we want to do. And look forward to the open call and your responses to them. Any questions? You're welcome.